Well, let's just first take a look at those three new tiers. So to begin with, we have the medium alert level, where COVID is currently lower than those northern hotspots. Now, in those areas, as you can see, the current national restrictions will apply. So that's the rule of 6 indoors and outdoors and the 10 p.m. curfew for pubs and restaurants. Now, currently, London is included in this tier, although Sadiq Khan, who's the mayor, said he believes the capital should move up a level. That would place London in the high alert level. Now, the key measure there is no mixing between households indoors. The big thing, though, that we had today was that areas with the highest infection rates, well, they are going to go onto the very high alert level. And look what's going to happen there. All pubs and bars close unless they can become restaurants. No mixing of households indoors or outdoors, and avoid travel in or out of the high alert areas unless it is for work or it's for education. Now, a series of factors will determine whether an area goes into this category. That includes the positivity rate. That's the proportion of COVID tests coming back positive, and hospital admissions. Now, areas in this category will be reviewed every month. Here's what the Prime Minister had to say about all of this.
There are already more COVID patients in UK hospitals today than there were on the 23rd of March when the whole country went into lockdown, and deaths, alas, are also rising once again. These figures are flashing at us like dashboard warnings in a passenger jet, and we must act now.
Now, earlier, the Prime Minister announced that the Liverpool City region will be the first to enter the very high alert level. There you go. But there will be extra measures there. So gyms, leisure centres, betting shops, adult gaming centres and casinos will also close. Those extra measures are significant because at tonight's Number 10 press conference, England's chief medical officer said that the baseline measures for that top tier do not go far enough.
I am not confident, and nor is anybody confident, that the Tier 3 proposals for the highest rates, if we did the absolute base case and nothing more, would be enough to get on top of it.
So a pointed intervention by Chris Whitty. All that after Boris Johnson indicated that he won't be forcing areas into the highest category. But he does appear to believe that large sections of the northwest, the northeast and Yorkshire and the Humber should follow the Liverpool City region. But for the moment, those regions will be placed in the middle high alert level. So, a Prime Minister struggling to persuade regions to go into the higher tier, which his Chief Medical Officer believes does not on its own go far enough. And tonight we were given a flavour of why the scientists are feeling uneasy. The Scientific Advisory Group on Emergencies published the conclusions from their meeting on the 21st of September. That was the one that led to the compromise on the 10 p.m. curfew. So let's look at what those scientists recommended and what actually happened. So they recommended firstly a circuit breaker, a limited lockdown. That didn't happen. They recommended that you should work from home if possible. That did happen. They said no households mixing in other homes. Limited version of that happened. They said closing all bars, cafes, restaurants and gyms. Well, as we saw today, a limited version of that is going to be happening in the top tier level, although they will still be able to remain open if they can serve what is described as a substantial meal. And then finally, no face-to-face teaching at universities or colleges. That hasn't really happened because the government has been talking about an appropriate mix between online and face-to-face teaching. So big questions tonight about whether this new tiered system will actually work after that warning from Chris Whitty that the very high tier level may not be enough on its own. And on Number 10's struggle to persuade some areas to go into that tier, I understand that North East Council leaders spoke to the Prime Minister's senior advisor, Sir Eddie Lister, yesterday. They said they would only agree to go into that tier if two things happened. Firstly, they would need to be given full control of track and trace in their areas with lots of funding to support that. And secondly, they said they needed a proper furlough scheme. That was the one that was running at the height of the pandemic. I'm told that those discussions petered out. Emily.
Nick, thanks very much indeed. So what does the evidence show us about the way the virus is moving? The Prime Minister warned that hospital admissions today were at the level they were on March the 23rd. That's the day that we went into national lockdown. Are we heading to the same level of pandemic this time around? Our health correspondent Deb Cohen is in Stockport, which is currently on Tier 2, high alert, with a warning it could go higher.
They've been back open just 3 weeks at Kids Saurus Soft Play in Stockport. Many of those here have no inkling of how things have changed, but the owners do. The rule of 6 has killed their big earner.
Our main source of income was birthday parties to make the little ones so happy. We can't do birthday parties anymore.
To be honest, that was the main rewarding part of doing that business, just to see the cheerful faces.
Newsnight visited Kids Saurus this morning before it was confirmed they can stay open, for now at least. The fear was palpable.
Very, very, very stressful. Not sure what's going to happen, whether we can still continue. We've got our staff's we were like one big happy family here, and we're quite stressed with how things are going to be for the staff.
Every 90 minutes, the staff here eradicate all trace of what's just gone. But today's news from the scientists suggests COVID isn't about to disappear anytime soon. This graph shows how new hospital admissions with COVID are varying by region. It's around 13 per million in the northeast, 18 in the northwest, and nothing like that elsewhere. Zoom in on different hospital trusts in the two regions, and you see one of the reasons why Liverpool finds itself in Tier 3.
Just a few weeks ago, we were talking about a rising number of infections, but now we're looking at increasing hospitalisations and a fear in some parts of the country the NHS may be overwhelmed. That's why Nightingale hospitals, such as this one in Manchester, are being prepared to take patients with COVID and other conditions.
Not everyone is convinced the Nightingales are about to get serious use.
I think talking to people who've been closely involved in setting up several of the Nightingale hospitals, they have said that something will have gone very, very wrong if they do need to be used in any substantial way. So I think that that they're still not a big and real part of the plan for responding to coronavirus, and therefore I think putting them on standby is a little bit of a cautious step, and perhaps also a bit of a PR move, a signal to the wider community to take these things very seriously.
That may be so, but there is a real concern here. The rising infections could have serious consequences for local hospitals.
That as rates of infection rise, there's often a lag of 2 to 3 weeks before there's a requirement for critical care, before that translates into critical care. So we're really concerned at present with these rising numbers of patients, elderly patients with other medical conditions, making them, of course, more susceptible to infection. I'm thinking that it's starting to become difficult now, but in a couple of weeks, that need for critical care may be really extreme.
Hospital admissions in the northwest are clearly higher than elsewhere, but some also suggest the health service here could be less able to cope than in London.
There are fewer intensive care beds per population in the north than there are in London, and there's less of a concentration of those very big teaching hospitals compared to what you have in London, and therefore there is a bit less scope to rapidly expand intensive care without compromising other non-COVID services. And there are fewer options for diverting to other neighbouring hospitals than there would be in London.
At Stockport's Wheatsheaf pub, they're keenly awaiting the fate of their local. The pub's claim to be COVID safe carries perhaps more ballast than most. Landlady Serena Hurst spent 30 years as an NHS nurse. She specialised in infection control. And here there's relief.
I think if we weren't allowed to continue, it would cause some hardship for some of our customers, because a lot of them live on their own and come here, that social scene really, and it's really important to them. Since today I would have put my stock order in for the coming week, I've had to hold off that because the last time we closed down, we had to dispose of all the beer, which was quite costly, which was on the brewery.
Had Greater Manchester gone the way of the Liverpool city region, arguably the UK's most COVID-secure landlady would have had to shut. For now, the Wheat Chief offers vague normality for the regulars in irregular times. The battle over its fate settled, for now at least.
Deb Cohen reporting from Stockport for us. Well, we're joined by Saffron Corduroy, who's Deputy Chief Executive of NHS Providers, which represents hospitals and other NHS trusts. Rushnara Ali is Labour MP for Bethnal Green and Bow, and Councillor Kay Cutts is leader of Nottinghamshire County Council. Welcome to you all. Saffron Corduroy, if I can start with you. You've heard what the Chief Scientists have said this evening, and you've seen, I presume, the notes from SAGE. Give us a sense of what it's like in hospitals now. With the infection rate rising, what are you actually seeing on the ground there?
So what we are seeing on the ground is hospital chief executives telling us how concerned they are about the rising rates of infection, the rising admissions that they're seeing across their hospitals, and also the increased levels of occupancy in ICU units in particular. So we really are seeing this ramping up. And as your report has said, we are back at the March level. So there is real concern out there. And we are clear that we really do need to move to some tougher lockdown measures if we're going to turn off the tap of infections and support the NHS through this winter.
When you say support the NHS, do you worry that hospitals will be overwhelmed?
I think the real issue to focus on here is that we need to get through this winter by treating COVID patients and also treating people with other conditions. We need to continue to carry out routine operations, diagnostics. We need to make sure that our accident and emergency departments are fully functioning. So that's a really big focus. It's not just about managing COVID, it's about managing this in the round. And winter, as you know, as we all know, is incredibly pressurised in hospitals and across other services. This is about ambulance trusts, mental health trusts, community services as well.
Councillor Cutts, from where you're standing with Nottinghamshire, it was interesting, wasn't it, that no sooner had the PM introduced those new 3 tiers that we heard the real opinions of the Chief Medical Officer saying he's not confident that even Tier 3 will get to where we need to be to stop those admissions being overwhelmed. Your thoughts?
Well, in Nottinghamshire, we have the virus rate somewhere between 90 and 290 across the county, about 900 in the city. And therefore, I think the level 2 is absolutely the right level for us. I held a meeting last week with my colleagues, that's the leaders of the district councils and the leader of the city council, and we talked this matter over, and we decided we wanted to all stay together. So level 2, I think, is suiting Nottingham City and Nottinghamshire because we all agree with that.
Yeah.
And I honestly think we're going to this way get on top of the virus because, of course, level 2 actually means that there's no mixing in households, and that will be strictly adhered to. It also means that the pubs and the clubs and the bars will close, the hospitality, at 10 o'clock, which I think is a good idea. But it further means that people can still meet in groups of 6 outside. So there is that possibility to keep socialising on a very, very limited level.
I can understand.
Certainly not indoors mixing.
Sorry, I can understand why, of course, you'd want to keep the whole area together. But when you break it down, Nottingham itself has got 834 cases per 100,000. I mean, that's higher than Liverpool, which is in the top tier. So I wonder how realistic it is to do that, to pretend that it's the same for Nottingham as it is for Nottinghamshire, when you can see that disparity, and you must be worried that the city itself will be overwhelmed.
I'm not pretending about anything. We've talked to each other and come to sensible conclusions. Surely we leaders on the ground know a little bit more than just some sort of blanket assumption. And we decided between ourselves, and that includes the leader of the City Council, we would rather be together because policing it otherwise would be very, very difficult. And I know we have the support of the Chief Constable, Craig Guilford, in this. He's actually leader of the Local Resilience Forum, And his opinion is to try and police it differently will make his job extremely difficult. And a lot of the virus is among students who will be on campus. So they've tested and traced them. They know where they are, and they are being very sensible and staying on the campus. So we're hoping to get on it that way. But really, you have to consider the whole economy. The Prime Minister is walking a very, very delicate line here between keeping the economy thriving and keeping people safe. And that is a difficult thing to do in these circumstances. I support him.
Let me bring in Rushanara Ali. From where you're sitting, your own leader seemed less convinced that these measures were working. Keir Starmer seemed to have changed his approach today and said, actually, I'm sceptical about whether these are working now. Do you believe that, particularly in Tower Hamlets, which is one of the worst hit areas, these measures are enough for you?
Well, look, we've always wanted to see the government take action so that they can get a grip on this virus and also make sure that the economy is able to resume. And what's happened is that the time that has been gained from the first lockdown and the pandemic beginning, a lot of time has been lost in terms of not getting testing and tracing right. The government set up a very centralised national programme, not involving local organisations, local authorities. We begged the government to allow local authorities to work with local health partners to provide testing and tracing on the ground, because the tracing element can be done better at a local level. The government has failed to listen, and it's made it very difficult for local authorities to act in a way that can work in sync with trying to bring control over this virus. So what we need is the government to get a grip. What we've had over the summer is stop-start, a yo-yo approach to telling people to go out to work, then telling people to work from home.
And what would you
we need
want
some
now?
clarity.
What would you want now?
Well, we need an economic package to go hand in hand with the kinds of restrictions that local areas are facing.
Yeah.
In cities like London, we do need much more clarity about how to take preventative action. The infection rates have been rising. The testing
Would you
hasn't...
prefer to be going up to high alert now, to the top number 3?
No, I'm not saying that. But what I am saying, in a local authority like ours, area like ours,
very high, isn't it?
It's in the top 10 in terms of infection rates in London. Our mayor, has advised residents to stay apart between households, because we think it's really important to encourage people to voluntarily do all they can to minimise the spread. But we need the government to act, and that requires both clarity of messaging, but also a clear economic plan to make sure that businesses and families are protected as lockdown arises.
Saffron Cordery, let me bring you in, because Rushanara's talked about test and trace, and that's a point that Sage was making as well. Delays, poor rates of adherence have all played into where we are. Do you accept that has failed as a system for the NHS?
So we have consistently, as an organisation, on behalf of NHS trusts up and down the country, said that the government has had a stop-start approach to test and trace, and we needed to have got going with this much, much earlier and much more quickly. I think that an effective test and trace system was always one of the key elements that was going to get us into a more manageable place with coronavirus in the absence of a vaccine. So I completely agree that we need to make real progress on test and trace, and I think that some things have been done with test and trace to get it up and running as quickly as it has been.
Saffron, I'll be honest, your line's breaking up. We'll come back to you as soon as we get that sorted. Councillor Cutts, do you accept that has been a major failing on behalf of the government not to be able to sort that out?
Well, that's not quite the whole picture. We have had some responsibility for where the testing and tracing units go. What we don't have responsibility for is the results and how they are processed. And I would like to see there be more local processing, so we can absolutely get the information very, very quickly. So I agree with you on that. But we have had responsibility for where these units are going to go. And only today I was informed that we were thinking of doing it in one of the towns tomorrow. And then I suggested somewhere else it should go, I think, towards the end of the week, because we do need to know where the virus is, and we do need to know how to control it. We have had control of these units for some little time now.
You did say at the beginning that it's a very fine line that the government's walking, and certainly within his own party, I think it was Charles Walker this afternoon, but there have been others, He said the Conservative government was trying to abolish death. His point being that actually at some stage we had to accept that people in their 80s and 90s would die, and that not every single life could be saved because it was hurting younger people's life chances and prospects. Do you accept where he's coming from? Do you agree with that?
Well, I do think we need to protect our older citizens, and if we can protect our older citizens by being sensible and carrying out sensible precautions, I think we should do that. We shouldn't be condemning anyone to death. People do die, of course they die. They die every year. They die from flu every year. But nonetheless, there is a responsibility between the generations to look after each other. And I know the young people have responded to this, and they are very careful. They don't want to lose their grandparents or great-grandparents, and that's why they have been prepared to behave themselves quite sensibly.
Saffron, you're back with us. Do you agree with that? I mean, do you think that, this is what the NHS has to deal with the whole time? Who are you going to treat? Are you going to treat cancer patients? Are you going to treat young people with heart problems? Are you going to just try and save the lives of those who are in their 80s and 90s? I wonder if you accept that maybe the balance has gone too far.
No, I don't accept that. I think that we are in a situation, which is what we have said, that for hospitals to deal with what's directly in front of them, they need to see a tougher down so we can turn off the tap of infections. Because if we're going to run a service through this winter, which can deal with both COVID patients and also those who need other types of treatment, routine treatments, cancer treatments, diagnostic treatments, then that's what we need to do. We need to stem the flow of admissions for COVID into hospitals. So it's absolutely the case that if we have an effective control of how infections are transmitted, then we can make sure that the NHS can be supported through this winter. Remember, the winter is a really, truly busy time, and we've got a workforce that is incredibly tired and burnt out.
And overworked from this past year. Absolutely. I think we could all agree with that. Rishna, let me just ask you, in terms of, I mean, you've explained you want more, obviously, you want more support for track and trace, and you want more financial support. But we are where we are in terms of what you're getting now from the government. Would you push to get Tower Hamlets or to get your London Borough into a different place in terms of preventative measures? They can do that if they're tier 3. You can impose more local restrictions. Is that
look, the government, that's not the point. The point is that the point is we are not going to be able to tackle this virus without dealing with the systemic issues. This government has not had a strategy in getting a grip on this virus, and that is why we're seeing deaths increasing. They haven't learnt the lessons from what happened in the first lockdown, and what we need to see is the government getting a grip on the infection, as the health professionals are saying. And what we've seen over the last few months is this strategy. There's been one strategy, which is to blame everybody else, blame public servants, blame other institutions, but not take any responsibility for the spread. And that's what needs to happen.
Thank you all very much indeed. Thanks for joining us this evening.